Hello. Welcome to Actuary Voices, the podcast from the American Academy of Actuaries. I'm your host for this episode, Ted Gotsch, and today we will be speaking to three of the Academy's leading policy minds: Senior Casualty Fellow Rich Gibson, Senior Retirement Fellow Linda K. Stone, and Senior Health Fellow Corey Uccello, about the recent election and how it could affect the Academy policy priorities in the coming year. With the return of Donald Trump to the White House and a Republican majority in both chambers of Congress, a shift in public policy priorities is likely in the nation's capital. But what will that mean to the issues the Academy is focused on the most, such as Medicare, the Affordable Care Act, Social Security, climate change, and more? I'm looking forward to diving into these policy conversations with my astute colleagues to learn more. But before I do, just a few words of caution about this episode. For our listeners, we are recording this on November 15th, 10 days after the election, so it is still early to have a lot of details on where the new administration and Congress will likely focus their efforts. We also don't yet fully know who will be appointed to leadership roles in the new administration. That said, our Academy Senior Fellows do have some insights, and we will be sharing those with listeners here. So with that out of the way, let me start with retirement. Linda, obviously, this is an issue that is a significant one to the Academy. And just to get started with, obviously, a topic that applies to everyone, Social Security, what is the Academy prioritizing with regards to pension Social Security policy issues as we look ahead to a new administration and a new Congress? Given the changes in leadership, are there any new solutions or considerations as we look to the evolving employment landscape and the continued growth within the retirement eligible population?
Yeah, thanks, Ted. We certainly do expect some changes in administrative priorities in the retirement area under the Trump administration. That said, we have seen two major pieces of retirement legislation in the past few years: Secure, which was passed in the first Trump administration, and Secure 2.0 passed under President Biden. So there is a history of bipartisan cooperation and focus on the need to enhance retirement security for all Americans. So these different pieces of legislation really focused on expanding access to employer-sponsored plans, savings for emergencies, and helping lower-income Americans who may not have access to any employer-sponsored plans through the savings match. So that said, while there is bipartisan agreement on a number of retirement issues, we do expect that the Biden Retirement Security Rule, also known as the Fiduciary Rule, will not be supported by the new administration. And with the expiration of tax cuts at the end of 2025, there is concern that the current structure and amount of pre-retirement contributions that employees make into their 401k plans could be subject to Rothification or becoming after-tax contributions. Because many people don't know this, but tax expenditures for DC plans is the number one on the list of all U.S. tax expenditures. So, as there is a look at where can we get more tax revenue, because there are a number of places where, Trump has said he wants tax cuts, there is concern that there's going to be at least a review of the tax expenditures on savings plans. So you mentioned the evolving employer landscape. So half of all private sector workers don't participate in any retirement plan at all. And we know that there's a lot more gig workers than there used to be. And so the Retirement Practice Council has been working on an issue brief that will be out soon that talks about gig workers and any policy changes that could help with their retirement security. One thing that I think it is important to note is that there is a current Department of Labor independent contractor rule that's likely to be reversed under the next administration. So again, I think this is going to be a revolving area that will need to be paid close attention to as we look at, the difference between employees and their requirements with regard to some coverage issues and gig workers. So I'm very happy that we are focused on this gig worker issues. More and more employees are kind of doing a gig work in addition to their day jobs, or frankly crafting together 3 or 4 different gig jobs for their employment.
Okay. Well, you obviously talked about a lot of different segments in the retirement bucket. Mentioned obviously Social Security, which is always top of mind. Unfortunately, there wasn't during the 2024 presidential campaign. It wasn't discussed, at least in depth, to a large degree. Mentions that maybe weren't particularly policy rich, or getting down into the real nitty gritty details. So, what do you think? What should policymakers be thinking about, and what do you think will be the top priorities in Congress and for the federal agencies in 2025 when it comes to about finding a long-term solution to address Social Security sustainability?
Yeah, Ted, that is so important. And you're right. I mean, there was some discussion on the campaign trail about protecting Social Security, and I say protecting in quotes, but there was not really an acknowledgement or discussion about the trust fund becoming depleted in about 10 years. In 10 years at that time, there's only going to be enough payroll taxes coming in to pay about 80% of everyone's benefits. So what does protecting Social Security really mean when politicians talk about this? Trump himself and the Republican Party platform specified that there would be no cuts in Social Security benefits and no increases in the Social Security normal retirement age, which is now about age 67. There was a Republican study commission that did advocate for raising the Social Security normal retirement age because people's longevity has been increasing. But Trump said very specifically that he would eliminate taxes, income taxes on Social Security benefits. He also said that he would eliminate taxes on tips and taxes on overtime. So all of these changes would decrease the amount of money going into the Social Security Trust Fund. Also, if people are not paying taxes on their tips or their overtime, that's going to impact their actual benefits from Social Security because those benefits are based on their pay. And as you know, one of President Trump's key promises was to deport illegal immigrants. So immigration has a positive impact on the Social Security system. And this has been getting a lot of attention. I live in Pennsylvania, so I saw a lot of ads during the campaign, and some of them did address Social Security and immigration. And so I really recommend this issue brief for people interested in this because it goes into a lot of detail about all the different ways that immigration can positively impact the Social Security system, primarily because of the additional workers it brings into the system who are paying Social Security taxes. So one of the things that I think is really interesting, if you look at all the policies that Trump has proposed, and I'll include tariffs in there because they have an impact on future inflation. The Committee for a Responsible Federal Budget has estimated that those policies would advance the trust fund depletion date by 3 years. So that means there's even less time to come up with a comprehensive reform option that would make sure that Social Security benefits, continue to get paid to the people who are receiving them, and the money is there for people who are currently contributing to the system and expect to pay them in the future. So the Social Security Committee and the Retirement Practice Council has written about the trust fund and a lot of these reform options that should be considered in an issue brief. And there's also the Social Security Challenge, on the Academy website, which allows everybody to look at the options that are available and the impact they would have on solving the Social Security challenge of making sure there is enough money there. So if folks haven't looked at that, I would say that really is interesting, provides a lot of information, I think shows some of the challenges that Congress is going to have to come up with a bipartisan solution. Any changes to Social Security need 60 votes in the Senate. So it definitely will need to be a bipartisan solution to solve this. And the question is this administration going to tackle that big issue, or are they just going to, push it away and have the situation become more dire as time goes on?
Right. Absolutely. Well, I know another big segment of retirement that was focused on in 2024 by the Academy and by the Retirement Practice Committee was obviously the 50th anniversary of the Employee Retirement Income Security Act, with a symposium, multiple issue briefs. That said, now as we go into new year, new administration, new Congress, what should employers be thinking about when it comes to pensions and the future of retirement security?
Well, you're right. It was a fun year with ERISA at 50 for a retirement actuary. It was great to look back at its history. There were a lot of stories being told by people who were there at the time of those early days, for those of us who weren't practicing at that time. And also looking ahead, ERISA was so important to make sure that folks got the benefits they were promised, and thinking about what changes would be needed going forward to keep ERISA strong in protecting retirement security. As I had mentioned, very few private sector workers participate in a DB plan. Currently, it's only 11%. And that skews towards higher paid employees working in large companies. And we have seen employers exiting plan sponsorship by closing their plans, freezing benefits, offering lump sums, and transferring benefits to insurance companies. So one reason this is happening is the level and structure of the premiums that employers have to pay to the PBGC. So it's been very heartening to see that there's bipartisan consensus that changes should be made in the premium structure in order to keep employers sponsoring plans. And the pension committee has been very active, speaking with Hill staffers and stakeholders about all the options that are available going forward. So we have an issue brief on this topic if people want to read a little more. So going forward, again, I think that activity around PBGC premiums hopefully will be continuing. One other thing I want to mention that employers would be interested in, that seems to be a focus of the Trump administration, is relieving regulatory burdens. And so there are a lot of regulations around retirement plans that employers have to comply with. So it would be interesting to see how this priority might impact retirement plans going forward in a way that would be beneficial for employers. There seems to be a thought that this administration might have less concern on some protections for participants. But again, I think we'll have to wait and see how this all plays out. So with regard to retirement in general, many employees now rely primarily on defined contribution plans to get their retirement benefits from. And President Trump said in the last administration that he loves 401k plans. He tweeted something to that effect. So I think people take some comfort in that these plans will be protected. And again, looking at how they can be enhanced for employees going forward. One of the key challenges for employees in these plans is figuring out what do they do with that amount of money that they have saved over their working lifetime when it comes to retire, because it's up to them to manage that bucket of money and make sure it lasts their lifetime. So a key challenge is the provision of lifetime income. How do you make that money last for your life? And that's why defined benefit plans are so advantageous, because it is guaranteed lifetime income. So we have a new defined contribution committee in the Retirement Practice Council, and they soon will be releasing their first issue brief that is going to focus on payout options for defined contribution plans. We know that employers recognize the need for lifetime income options. There's been some changes in Secure and Secure 2.0 that were done to make employers feel more comfortable offering these options, but there's still, I think, a reluctance, or I would say employers are still in the period of evaluating the many types of options that could be available and deciding if this is something they want to go forward with to put in their plans.
Right. Absolutely. I mean, Linda, you've obviously, as we've been chatting here, you've been talking about many different aspects that fall under the retirement umbrella: Social Security, pensions, 401ks. But there are also a lot of questions around longevity and the gig economy, which I know you briefly touched on, and shifting demographics of the U.S. and the broader global population. And just was wondering, as we think about all of that and the broader implications of long-term savings and the cost of aging, any ideas, thoughts of what should policymakers and the media be asking actuaries about when we think about the different policy levers we have?
Well, I have to say, one question I often get asked personally when I tell people I'm an actuary is, how long am I going to live? Now, I don't have a crystal ball, but I do have the Actuary's Longevity Illustrator, which I have to mention that the Academy developed in conjunction with the Society of Actuaries. And I mention this because one of the biggest mistakes that people make in retirement planning is underestimating how long they will live. And this is really important from a policy perspective because it emphasizes the importance of Social Security to retirement security, since Social Security benefits are increased every year with cost of living, and they're paid over someone's entire lifetime. And this is also why longevity is also why adding a lifetime income option to a defined contribution plan is so important. So if we think about broad policy levers that should be addressed to enhance retirement security, Social Security is clearly there at the top of the list because it is such an important component of retirement security, sometimes the only component of retirement security for Americans. And there's a lot of concern out there about what's happening with the program. There's a lot of misconception about what does it mean when the trust fund runs out of money. Does that mean there's no money at all? People don't realize, no, there's still taxes coming in from workers. So it would be really positive to have the solution around Social Security, be addressed sooner rather than later. I think another broad policy lever is to address the fact that large percentage of Americans don't have access to any retirement plan to save. In the private sector, half of all workers don't have any retirement plan available to them. And so if you think about trying to save without having money automatically come out of your paycheck, that is very hard to do, to have the discipline to do that. And many people are struggling, cobbling together several jobs, really don't have money to save. And so looking at how to get more Americans access to retirement plans, is something that, has been considered. There have been bipartisan bills in the past on structures around this. There have been proposals to have a national type IRA plan where if an employer does not sponsor a plan for their own employees, that there's a mechanism where employees can still belong to a national plan to have money taken out of their paycheck. And this latter idea really was supported by the Democrats. And so it does seem there is not a Republican desire for this type of mandate at this point in time. So there are a number of state plans that have become enabled in this area. So states have set up their own plans, automatic IRA type plans, and there's more states considering these all the time. So with no movement on kind of a national plan, I would expect that more states would be moving forward because there is a recognition that this really does help people save. So we may, see more states coming on board knowing that the federal government is not going to act in this space. And I think just all the changes that have come through Secure and Secure 2.0 to help retirement savings have auto enrollment, auto escalation. So again, thinking about how can we get people to save more, as well as providing emergency savings vehicles, because if folks don't have emergency savings, they're tapping into that retirement account versus having it be there for them when they retire. There is thought that there is, a Secure 3.0 coming at some point down the road that we'll continue to see, how has Secure and Secure 2.0 provisions, how are they working out? Some of those aren't still fully implemented yet, and trying to look at those gaps and solve those going forward. And I think, as I've said, it's very heartening to see there's a lot of bipartisan interest and working together on these retirement issues. So that's all I have, Ted, at the moment.
That's a lot. That's not a lot, as some people say. So thank you for all of those details and for all your insights, Linda. I very much appreciate that. And with that, maybe I'm going to switch over to Rich Gibson to talk a little bit about property casualty issues. And Rich, I mean, you have a very broad swath of of different topics that fall under that umbrella. One of which is not just for actuaries, but for Americans, is one of the hottest topics today: artificial intelligence. It's all over in every newspaper. It's frequently talked about by policymakers and business leaders. And with property casualty, actuaries frequently at the front line as we talk about climate and cybersecurity. Where do you see AI fitting in, and how can they help policymakers address some of these issues?
Well, Ted, you're right. Regulators and legislators are watching and weighing in on AI. The White House, in Executive Order 14110, Safe, Secure, and Trustworthy AI, laid out 8 guiding principles for AI. These principles are aimed at federal agencies. Further focus on AI principles is provided by the National Institute of Standards and Technology, that's aimed at providing guidance to industry as AI applications are developed and rolled out. Further, the National Association of Insurance Commissioners has spent considerable time on this and has led to a model bulletin on the use of AI systems by insurers. And of course, various state regulators and legislators have implemented varying positions on the use of AI in insurance. So there's some commonality among all of this. All of these have articulated aspirations to reap the benefits of AI while controlling potential detrimental aspects. Generally, in the effort to control detrimental aspects, the emphasis is being placed on risk management and governance. Clearly, actuaries have considerable impact in both these areas. One other thing I would point out, property and casualty insurance is not generally regulated at the federal level. It is largely regulated at the state level. So a lot of the state level activity that we've seen already is going to continue to move forward.
Excellent point. Excellent point. Another topic that sort of falls under the PC umbrella is cybersecurity. The Academy has created a cyber toolkit, which is a great resource for state and federal regulators. And looking ahead in 2025, are there any challenges that are particularly important for insurers and regulators to address or think about, especially given the increasing propensity and impact of cyber attacks on public and private sector entities?
Well, first, Ted, thanks for mentioning the Cyber Toolkit. The Academy's Committee on Cyber Risks has expended significant time and effort to develop the toolkit and its content. Currently, there are more than a dozen papers and or resources within there. More are being researched and discussed all the time. So I'll start answering your question by first saying most, if not all, conversations regarding cyber risk start from the premise that cyber threats and cyber attacks continue to evolve. In short, the landscape of threat vectors is ever changing. Certainly, underwriting for risk and cyber hygiene is evolving as well. And this combination is a primary challenge in the cyber market. Adding to this is the question of how well the average individual or business understands the exposure to cyber attacks and their consequences. Viewed long term, I think it's reasonable to expect that this understanding will grow. Similarly, the cyber insurance market is expected to grow. Near term, regulators and legislators will likely grow their focus and understanding of cyber risk exposure as well. We can see that at the NAIC through its Cybersecurity Working Group, at the federal level through the Cybersecurity and Infrastructure Security Agency, or CISA, and the Federal Insurance Office, and at the state level with increased rollout of data privacy laws. So let me leave you with one last thought. As one considers the evolution in all of these areas, it's not difficult to expect that considerable risk still exists and considerable diligence will be required to reduce those risks associated with cyber attacks.
Okay. Well, thank you for all of that. One topic that certainly has been, given obviously a continued storms. We had a very strong hurricane season, sort of, in 2024. Extreme weather events such as hurricanes, floods, and wildfires and tornadoes really are testing property insurers and consumers like never before, given the high cost of claims and the challenges of managing the risk that has led to some difficult choices for companies, regulators, and individual homeowners. The Academy has certainly done work here helping convening policymakers, insurers, state agencies, and other interested parties to identify solutions and discuss implications of significant public policy changes. Rich, are there possible solutions or considerations that actuaries or the Academy should be identifying for both the immediate term and the longer term?
Well, Ted, I wish I could sit here and say that I've solved climate change, but sorry to say, I'm going to answer your question with a series of additional questions. First, is it reasonable to expect that additional costs associated with extreme weather continue to be passed on to insurance consumers through the price of insurance? Or in short, can we price our way through climate change? Can we help the average insurance consumer better understand what is and is not covered by an insurance policy? Is there manageable benefit to be gained by improved mitigation? And can we catalog and act on those benefits? Can we even identify all the correct constituents affected by the problem of rising costs and bring them together to seek constructive discussion of potential solutions? So I suspect there are numerous additional questions that could be asked. But I want to point to a number of volunteer groups within the Academy who are involved with these issues. First, the Extreme Events Committee is a long-standing committee at the Academy. More recently, the Academy has launched a homeowners task force. Additionally, the Climate Change Joint Committee is a cross-practice committee addressing many issues related to climate. And finally, I would be remiss if I did not mention the Actuaries Climate Index, which is a product of joint efforts among the 4 North American actuarial associations.
Well, obviously, one sort of, symptom of storms or effect of storms is, water and flooding. And again, obviously, we've seen our share in the United States in 2024 and in recent years and generally. There has been a lot of interest and focus on those issues that come from flooding, is particularly those who live in flood-prone areas. The National Flood Insurance Program has struggled for some time with funding issues, obviously, which has seemingly exacerbated some of the problems. Rich, what are the challenges hindering a long-term extension to the National Flood Insurance Program? And is the program robust enough to handle the increased climate changes in this country?
So, Ted, first let me say we've seen the news stories about the flooding and whatnot, and I would just want to say that the Academy's thoughts go out to all those affected by the floods, and it's not a new issue, right? It continues to happen. I'll go back a little in history. The need for the NFIP grew out of the belief by insurers decades ago that flood is an uninsurable peril in the private marketplace. Notwithstanding current efforts to provide private flood coverage, the NFIP still faces key challenges. Perhaps the most prevalent challenge is the very high cost of flood insurance in the most flood-prone areas. In short, flood coverage may not be affordable for those who need it most. Unfortunately, we continue to build more structures in flood-exposed geographies. The NFIP has responded to the need to move their rates to a more adequate overall structure through their rollout of Risk Rating 2.0, which is itself intended to better align prices with the riskiness of the properties insured. However, they've had challenges achieving what they call full risk rates because it takes some time to move in that direction due to an annual capping of increases in the rates. Currently, they're limited to 18% increases per year. So I should talk about the fact that FEMA recognizes they have some work to do, and they have put forth a 17-point proposal for reforms at the NFIP. I should also point out, in recognition of the challenges facing flood insurance and flood insurance consumers, the Academy has supported the proposition of long-term reauthorization of the NFIP.
Okay. Obviously we've sort of, these last couple of items we've discussed here are generally known to the general population, even if it doesn't affect them. Obviously storms happening, that's a major story. They probably comes into their, they hear about them, that sort of thing. But, many property and casualty insurance, issues and concerns are not always top of mind campaign issues or even knowledge, top of mind issues to just the public in general. If you were advising the next administration and other policymakers at both the federal and the state level, what would you encourage them to consider addressing?
So, Ted, recalling that insurance is generally regulated at the state level, our advice and focus would be to help those policymakers. That said, as we're thinking about the new administration, the question is difficult to answer with any specificity given the broad and open-ended scope when you consider the number of different lines of business and types of coverage that the property casualty insurance industry provides. That said, I'm going to say that just as the Academy has always done when assisting policymakers, I feel confident that we would seek to offer objective advice that is aimed at bringing clear, fact-based understanding to the questions and issues that they're considering.
Great. Well, Rich, thank you for your comments and insights on this wide swath of different issues. So, Corey, turning to you in healthcare, There just seems to be so many different facets to consider in this area, especially, as the Affordable Care Act turns 15. What are some of the top matters concerning this law that we should be keeping our eye on?
Well, the ACA individual markets have been fairly stable over the past couple of years, but I think that stability is at risk. The enhanced ACA premium subsidies that were enacted as part of the American Rescue Plan in 2021 and then extended by the Inflation Reduction Act, they're set to expire at the end of 2025. And with Republicans in power, it's probably less likely that they'll be extended. But some states may implement their own enhanced subsidies. Federally, I expect a return to some of the policies that were championed during the first Trump administration. And that would include things like loosening ACA market rules to allow for a broader range of options to some consumers, including association health plans and short-term limited duration plans. They might also explore alternative risk pooling options for people with high expected health costs. In terms of Medicaid, I expect there'll be a push to implement or re-implement work requirements. In addition, there may be a push to shift more cost to the states through reductions in the match rate, especially for Medicaid expansion populations, or through capping per capita federal Medicaid contributions.
That's all very interesting. Uh, what is some of the work the Academy has done in this area?
Well, one of the primary areas that the Academy's Individual and Small Group Markets Committee has weighed in on is how different policy options would affect risk pooling in the health insurance markets, and how changes in risk pools could affect premiums, enrollment, and the effects on people with pre-existing health conditions and their ability to access coverage. Although some options could help reduce premiums for those in good health, they could make it more difficult and expensive for people with pre-existing conditions to obtain coverage. We'll, of course, be keeping an eye on these and other ACA-related issues, and will continue to provide input to policymakers and regulators on these items.
Okay. Well, as you know, obviously, there were what seemed to be few substantial conversations on the campaign trail about the need to address Medicare sustainability and the options to do so. Given that, what are some of the next administration or what will the next administration or Congress do to tackle this challenge?
Well, it was disappointing, but I can't say I was necessarily surprised that candidates didn't say a lot about Medicare's solvency challenges and ways to address them. And that's because any solutions likely involve making tough choices. Perhaps another reason Medicare solvency hasn't received a lot of attention is that the recent Medicare trustees report pushed back the hospital insurance trust fund depletion date from 2031 to 2036. So it's either further down the road. So the problem might seem less urgent right now. That said, the Academy's Medicare Committee will continue to urge policymakers to act sooner rather than later to ensure the program's long-term solvency and sustainability. And that means making sure the program's affordable, not just to taxpayers, but also to beneficiaries. Now, there are a few areas in which Congress and the new administration might act, and some of these have bipartisan support. One likely area of action is updating physician payments. Part of this is aimed at increasing physician payment rates, which haven't been keeping pace with increases in costs. But there's also interest in realigning payments between primary care physicians and specialists. Doing that would help bolster the primary care workforce. Another issue with bipartisan support is extending telehealth flexibilities. Now, all of these things that I just mentioned would actually likely increase Medicare spending. So there would be a need to look for ways to offset that. And one possible option for offsetting these costs is to implement site neutral payments. So that is, Medicare payments for healthcare services would be the same, regardless of where they take place. Another option is to reduce Medicare Advantage payments. Now, more than half of Medicare beneficiaries are now enrolled in Medicare Advantage plans. And so there's growing interest in ensuring that those MA plans aren't overpaid compared to what the cost would have been in traditional Medicare.
All right. Well, shifting gears, financing long term care needs has been a public policy issue for decades. As you know, some individual states have or are exploring different types of financing models. Is there any interest on the federal side that you see?
I think there's definitely bipartisan interest in better addressing the needs for long term services and supports. And part of that is an increasing recognition of the need for home based services as opposed to services provided in a facility. But bipartisan interest doesn't mean there's agreement regarding the potential solutions. Whereas Democrats are more likely to favor addressing needs through government programs or social insurance programs, Republicans are more likely to prefer private insurance solutions. Innovation may continue at the state level, and they may be exploring combining public and private approaches. Now, I do want to note that both President elect Trump and Vice President Harris highlighted the needs of caregivers in their campaigns, with Trump proposing tax credits for family caregivers. One thing I want to highlight with respect to the need for long term care services is the shortage in the caregiving workforce. Immigrants fill many of these roles, and so more stringent immigration rules may actually worsen the workforce shortages.
All right. Um, well, the high cost of prescription drugs continues to affect access to medications. What can we expect the Trump administration and the next Congress in terms of addressing these high costs?
Well, the Inflation Reduction Act of 2022 included Medicare prescription drug provisions. These include Medicare drug negotiations for an increasing number of prescription drugs over time. And the first round of maximum prices is scheduled to go into effect in 2026. In addition, the Act requires drug manufacturers to pay rebates if prices increase faster than inflation. And it also made changes to the design of the Medicare Part D program and now includes a cap on out of pocket costs. Now, you may have heard that there are rumblings in the next Congress to repeal these provisions, but it's not clear those efforts would be successful. President elect Trump has indicated interest in drug reimportation and using international reference pricing to reduce prescription drug costs. So it'll be interesting to see if those kinds of provisions can be weaved into the provisions of the Inflation Reduction Act. One area of bipartisan interest has been PBM reform. Now, PBMs, those are pharmacy benefit managers, they're third party administrators of prescription drug programs. There have been proposals to change the way that PBMs are paid and to enact transparency requirements, both with the goal of reducing patient out of pocket costs.
Well, Corey, finally, I mean, as really everyone knows, artificial intelligence has been a very hot, top of mind issue in many different fields. But as it relates to healthcare, what does the future hold for the use of AI?
Well, I think there's a lot of enthusiasm about AI because it holds great promise. It can help healthcare providers diagnose conditions earlier and more correctly. It can help insurers perform administrative tasks more efficiently, and it can help consumers and patients better track their health. However, AI does come with risks. Incomplete data or biases in the data can result in AI inputs and outputs that lead to misdiagnoses, inappropriate care denials, or ineffective targeting of disease management programs. So, on the health policy front, there's a question regarding the appropriate degree of regulation of AI and how to balance safety, security, equity, and privacy protections with innovation. Now, whereas President Biden issued a wide ranging executive order on artificial intelligence, President elect Trump has promised to repeal that order. That said, there's been bipartisan congressional interest in increasing oversight of the use of AI in prior authorization decisions. And we're also seeing state regulatory oversight of AI, with a few states enacting legislation that regulates the use of AI in healthcare decision making.
And just sort of to close out the questioning, here's one that's for all three of you, Linda, Rich, and Corey. And maybe we'll start with Linda first and then Rich before ending with Corey. As we look across the mega issues that the Academy identified for the 2024 Election Clearinghouse, which, just for listeners to be clear, that was retirement security, healthcare, climate change, AI, cybersecurity, and risk management. Where do you see opportunities to work with other practice areas in 2025? And again, I get Linda, if we can start with you on that.
Sure. Thanks, Ted. I think the one that comes top of mind for most people would be the interplay with health and retirement. And that is because it's so clear from a retirement perspective that the cost of Medicare, the availability of Medicare is so critical as someone thinks about their own retirement security and how much money they're going to need. And the other piece of that is a lot of uncertainty for individuals around long-term care and how is that paid for, what's covered by some of these government programs, what are they going to be on the hook for themselves? And, looking forward to thinking about, health and retirement as, cohesive strategy, I think is something that, people need to be doing. With regard to, climate and retirement, where I've seen this is more in the general economy and just impact on people's premiums that they're paying for their insurance to the extent there's any impact there. And one of the things that, clearly overrides everything, and Rich, I'm sure we'll talk about this as well, is just the overall economy and what that is going to do as far as how it impacts individuals and, how that plays out in each of our different policy spaces differently.
Rich, do you have any thoughts?
So, a few, Ted. I'll first let me say that it is always a pleasure to spend time with Corey and Linda, and I'm in awe of the work that gets done in the retirement and health practice councils. The insights are tremendous. So, as I think about cross practice, certainly climate change affects everybody from the standpoint of health and retirement and P&C. I mean, it's a significant driver for inflationary costs. Linda alluded to this, and it's impacting the economy. I'll mention a couple of things that are already underway, and I mentioned the Climate Change Joint Committee earlier. We also have a Data Science and Analytics Committee that is cross-practice and takes on issues of AI. I expect that those would continue. I would also see that work on the Actuaries Climate Index will continue, and that certainly is not just P&C. If I were to characterize this all, and Linda alluded to the economy, but the issues of economic well-being span across all the practice areas. And there's plenty of opportunity to think about that within and across health, retirement, and P&C.
So, Corey, where do you see the opportunities to work with your fellow colleagues in the different practice areas in the coming year?
Well, there's definitely overlap between the health practice area and other areas. And for instance, I talked about AI earlier. I think the growing use of artificial intelligence and algorithms probably affects all practice areas. And it's important for actuaries to understand how these tools are developed and to recognize how any data limitations or biases may affect their results. And the Academy has already been doing cross practice area work on this topic.
Well, Corey, thank you. And thank you also to Rich and Linda for all your public policy insights at this time of change in the nation's capital. We really appreciate it. Today, I was speaking with Senior Health Fellow Corey Acello, Senior Retirement Fellow Linda K. Stone, and Senior Casualty Fellow Rich Gibson about some of the top Academy-related public policy issues that could be considered by the incoming Trump administration and a new GOP-led Congress. The January-February edition of Contingencies will go into further depth on many of these same matters. And to learn more, please go to www.contingencies.org. My name is Ted Gotsch. I am very pleased to have had the opportunity to host this episode of Actuary Voices, the podcast from the American Academy of Actuaries. Visit our website at actuary.org to learn more about all we do here at the Academy. And you can also follow us on X, Facebook, and LinkedIn. And don't forget to subscribe to this podcast at your favorite podcast platform. Until next time, be well.